Hello, I'm Kevin Berger. The Greater Twin Cities United Way has strengthened its commitment to improving the health and well-being of the Twin Cities by teaming up with Medtronic Philanthropy on a partnership to promote access to quality health care. The initiative will leverage shared research resources and community-based approaches. Here to tell us about this new partnership is Sarah Caruso, President and CEO of Greater Twin Cities United Way, and Caren Gaytko, Senior Vice President of Clinical Services for MVNA, formerly known as the Minnesota Visiting Nurses Association. Welcome to both of you.
Hello.
Sarah, can you tell us about this partnership and how it's going to evolve?
Well, we are so excited to be working with our longtime partner, Medtronic and Medtronic Philanthropy, to really bring an important service to the community, and that is community healthcare workers. There are neighborhoods in the Twin Cities and groups of fellow citizens that are not as healthy as the rest of us, and they are not receiving the healthcare services that they need. And so we have put together a 5-year, $2.5 million groundbreaking program which will bring more healthcare workers and services into underserved communities.
Now this is, I understand, a different kind of worker than we've seen necessarily in the past, this healthcare worker. Can you talk about that a little bit?
The community health worker is a role within the healthcare continuum that does a lot of education and has access to resources. So we will use the community health worker to not only do lifestyle healthy management education, but we will also utilize their skills in connecting the underserved with resources and attachment to programs.
So what are some of the barriers to people not getting the same level of service depending kind of on where you live, what your community is?
Well, let me first define what we mean by underserved. It's a sad reality in the Twin Cities that some neighborhoods and some immigrant groups as well as some African Americans are not as healthy as average Minnesotans. And they have fewer access to health care, maybe not as much healthy food, not as much time outside. So there's a whole range of issues which come to a neighborhood or an individual or a family that can affect their long-term health and generate problems such as heart issues, diabetes, obesity, things like that. But we know how to address those problems, and these community health care workers are a big part of the solution.
And what do they bring to those communities?
These community health workers are part of the community themselves. They are embedded in the community and are an active part of the role that they're about to play. So they already understand what the trials and tribulations are and what the access issues are that exist within the neighborhoods and the communities already.
Is language sometimes a barrier?
Certainly.
Language, culture. The goal that we have for this program is that the community health care workers will be from their community, speak the languages, have the cultural competencies to build the trust and the relationship that's needed when dealing with some of these chronic health issues.
And if this is not addressed, if there aren't some steps taken to improve this, what's at stake?
What's at stake is the health of the communities that we're trying to serve, and certainly that is very significant, but also the use of the healthcare system itself. We have strong community programs, and connecting these folks to those programs is essential, and making sure that they're getting the services that they need to treat the illness and diseases that they currently have. And not using the emergency departments as a primary care clinic will be a big
that can be a drain on
certainly,
the system for
absolutely.
everyone.
And one of the things, Caren, is I want to highlight is we not only have positive outcomes at the individual level, but we have them in our medical systems, our hospitals, and in the whole community.
Absolutely. So
there's a lot of wins in this idea.
Best of luck as you proceed. If you want to learn more about this, it's medtronic.com/philanthropy or call 211 to learn more. That's Comcast Newsmakers. Thanks for watching.